Because of economic fallout from the pandemic, many people in Massachusetts have been forced to find another source of health insurance. That explains the increase in people signing up for the state's Medicaid program, Mass Health. People looking for new coverage can also take advantage of open enrollment for Mass Health Connector. To tell us about the options is the Chief of Policy and Strategy for the Connector, Audrey Morse Gasteier. Thank you very much for being with us,
Thank you.
Audrey.
Thank you so much for having me.
Audrey, I want to start with explaining the difference between Mass Health and the connector, because people who want Mass Health coverage can certainly use the connector, but you can help other people look for other options as well, I guess, right?
That's absolutely right. So if people come to the Health Connector's website, mahealthconnector.org, they can apply for health coverage. If they qualify for Medicaid or Mass Health here in Massachusetts, the system will help enroll them in Mass Health. Many other people qualify for affordability programs through the Health Connector, like our special Connector Care program that makes free or low-cost coverage available to people through the Health Connector. Also, people who don't qualify for subsidies, middle-income people, can also enroll in all kinds of health coverage options through the Health Connector. So everybody can come to the Health Connector and we'll find out how to get you into the most affordable coverage available to you.
Is there anything you can tell me about the enrollment pipeline this year, the kind of people who are signing up, and maybe how many?
Sure. So we're in an open enrollment period right now at the Health Connector, and that runs from between November 1st to January 23rd. And this is the time of year when anybody can come into health coverage through the Health Connector. People who are already covered through it can come in and shop around, pick a different plan for the upcoming calendar year, or new people who have been uninsured or having a gap in coverage can come and get covered. There's a lot of activity happening right now because of open enrollment, and we want people to understand that they can come in, select a plan by the 23rd of December to start coverage January 1st. But we've also been seeing a fair amount of activity throughout the entire year and really around the pandemic, because there's been a lot of economic impacts for people losing employment, and along with it, maybe losing job-based coverage too. We've seen a fair amount of activity in terms of people coming in, maybe who've never used the Health Connector before, have never come to state programs for health coverage before. So we're doing a lot of work to try to make sure people know we're available. This is the state's place to come if you don't have health coverage through a job or in some other way.
Well, I know for people who lose a job along with their health coverage, that's a real crisis, and that's almost relatively simple. But what about people who are furloughed and they might still have access to a plan even if the employer isn't contributing as much? What about their situation?
Absolutely. So a lot of people, when they lose their job or get furloughed, they're offered something called COBRA. And that means you're still in your employer's plan, but instead of you sharing the cost of that health coverage with your employer, where in most cases they were paying the majority of it, you're now paying completely on your own. So for a lot of people, that's really, really expensive. It can be $500, $600, $700 a month. People in that circumstance should really come to the Health Connector and explore their options. Most people who come to the Health Connector, particularly if they've lost their job, will qualify for our low-cost program, Connector Care, which has $0 premiums, very low premiums for people, low, if any, cost sharing, no deductibles. So they should know that there's more affordable options available to them. Come check out their options with the Health Connector. Even people who don't qualify for Connector Care, however, still can choose from 9 medical carriers on our shelf. We have all the leading insurers in Massachusetts. You can comparison shop and find your way into a plan that will be much more affordable for you. So this is a great time of year for people to do that.
Now, when people hear Medicare, they might be thinking, well, you have to be really poor, almost persistently poor to qualify. And we're talking about people who were making maybe pretty good money at the beginning of the year, and now they're out of a job. So they might be wondering, well, what does that mean about their eligibility?
Sure. So it's important for people to know in Massachusetts, even people who are up to kind of middle income can qualify for help paying for health coverage, whether that's through our state's Medicaid program, Mass Health, which serves lower income population, the Connector, which our Connector Care program serves lower to moderate income people. But for example, our subsidy programs go up to a person, a family of one, an individual earning about $38,000 a year, a family of 4 earning about $78,000 a year. People under that threshold can qualify for a lot of help with their health coverage costs. But again, even above those thresholds, people can find their way into much more affordable options than they might think. So it's important to think about it kind of like a sliding scale. But people who've lost income certainly have a lot of options available to them in terms of low cost or free health coverage.
How does the exchange help people save money exactly? Because if they're not even getting much of a subsidy, does it really make that much of a difference?
Absolutely. So even if they're not getting a subsidy, the price differential between different insurance products can be really huge. It can be, twice the amount you may be paying for really the same kind of insurance product or a different type of network. So that's why comparison shopping is so important. And we're fortunate to have so many different insurance companies available through the Health Connector. So people shopping around, checking out their options is really, really important for them to be able to do. And there's often much more affordable options than people may realize. And again, that's even without subsidies. But most people who come and shop at the Health Connector do qualify for subsidies that will help make their coverage even more affordable.
One other thing I think it might be good to explain for people who might not think they need to use the connector right away, but they're afraid of missing a chance to enroll. I guess they can enroll at other times, but only if certain circumstances come into play. Can you say a little bit about that?
Absolutely. So during the rest of the year, you need some kind of a qualifying event to get into coverage, change in life circumstance, you get married, you lose coverage through a job. We also have an opportunity throughout the year for people who newly qualify for connector care. They can come in at any time. But for everybody else, open enrollment, which we're in right now through January 23rd, is the only time of year when anybody can come in for any reason. And so this is when we're trying to do the most, outreach and out talking to people and raising awareness about how important it is to come to the Health Connector, explore your health insurance options, get enrolled. And for people who want to start coverage at the beginning of the new year, they need to come in and select a plan and make any applicable payment by December 23rd to make that happen.
Well, just before the pandemic in this country, there is a new rule put in place by the federal government about being a public charge. This applies to some immigrants, not all immigrants, but I'm sure there are many immigrants out there wondering, if I enroll for, let's say, Mass Health, is that going to count against me in some way?
So, we spent a lot of time looking at that rule and talking with folks who work closely with immigrant communities, understanding that it could raise concerns for a lot of people. Coverage through the Health Connector is not one of the kind of triggers that can cause concern through the public charge rule. So we try to make that clear to people in terms of how important it is for them to continue to come forward and get health coverage. I know that rule is being litigated in court and has run into a lot of obstacles, and we'll see what happens to come there. But we want to make sure people have the resources they need to come and get enrolled in coverage, and that anybody who's eligible for coverage really should be getting it. It's so vital for people to have health coverage, particularly during a pandemic, and we don't want them to be worried about those sorts of concerns.
For people who have not enrolled before, is there anything you might want to suggest about preparation? Because, once you start filling in a form online, you don't want to find out that you have to go and look for something that might be hard to find. What should they be thinking about?
Sure. So when people start an application, just having, all the key information, about themselves, their contact information, being ready to attest to where they live, if they live in Massachusetts, being able to estimate their income for the year, that kind of information. But the application will walk people through that, and anything that they're not able to provide or attest to right then, there's, processes for them to be able to mail in documentation or upload it to the system. So it's something people can kind of do as they go along, but it's also important for people to be aware that there's help available for people as they make their way through the application process. We work with special organizations called navigators, and we have many all around the Commonwealth, and right here in Boston, we have the Boston Public Health Commission, and we also close by have the Cambridge Economic Opportunity Council, and these organizations can help walk anybody through the application process, particularly if they're doing it for the first time and they need a little assistance getting over the line. So please reach out to those organizations. They are trained and able to help people, and they can do that over the phone and virtually in whatever ways people need. So it's important for people to avail themselves of those resources if they need any help along the way with the application.
I know you mentioned the open enrollment period, but I guess people might also want to keep in mind these rolling deadlines. For example, if you want coverage that takes effect on January 1st, you have to make sure that there's an earlier date to keep your eye on.
That's right. So for people who want to have their coverage kick in on January 1st for the new year, making sure you've selected a plan and made a payment by December 23rd. If you miss that date, January 23rd is the next important deadline. That is the end of open enrollment. So you really have to have picked a plan and made a payment by then, and that coverage would kick in on February 1st.
Finally, if people want to get some more details, anything you can say about a website or a phone number?
Absolutely. So people should check out our website. It's mahealthconnector.org. That's where they can fill out an application. They can explore information about plans they may qualify for. They can also find their way to navigators, organizations that are trained and equipped to help people with any questions they have about the application, filling out an application, staying covered. So we really encourage people to come to the website, contact their navigators, make sure you take action by December 23rd. We know it's a really busy time of year around the holidays. So making sure you're going in, you're getting this taken care of, and you have health coverage for yourself and your family, which is always so vital, but particularly right now, given the COVID pandemic and everything people have been going through in terms of economic hardships and job changes and the like. Just crossing health insurance off your list is something to worry about is so important right now.
Well, thank you very much for taking your time to walk us through that.
Thank you so much for having me, Chris. I appreciate it.
Audrey Morse Gasteier from the Massachusetts Health Connector. And we'll have more news in just a moment.